Test. Okay, perfect. Sorry, I just recorded a full video. It was great, but I didn't record the PowerPoint section, so sorry. Take 30. So, my name's Adam Boulsoud, and today we're going to be talking about Lovastatin, all the fun stuff behind it. So this presentation, it'll walk you through, the basics of cholesterol, what Lovastatin statin can do, how it works, and all that fun stuff. So, what is Lovastatin? Lovastatin is a cholesterol-lowering medication. It's part of the statin family, and there's multiple statins. And statins work by inhibiting the HMG-CoA reductase, which we'll go into a little bit later. It'll come in 10, 20, 40 milligram tablets, but of course some providers like to change it up. They'll do 1.5 tabs. It just depends on the patient. So it'll slow the production of cholesterol in the body. So we've been throwing around this word cholesterol. What even is a cholesterol? So cholesterol is super essential in our bodies for several reasons. Essential for cell membrane, helps produce steroid hormones, and also important, it's a precursor to bile acids, and bile acids of course help us digest fats. And you can get cholesterol in two ways. So you can get it, naturally through the liver, and you can also get it from these beautiful foods right over here. I don't know if you can see my mouse, especially this one right over here. So there's a couple types of cholesterol, but mainly it's LDL and HDL. LDL is a bad one. When you have a lot, you'll end up with atherosclerosis, which is just a really big buildup of plaque in the artery, as you can see here and here. And of course, when you get a plaque, nowhere the blood to go, you'll get a heart attack, unfortunately, and some patients pass away, some patients don't. But let's look briefly at how our bodies make cholesterol. So the process starts with a molecule called acetyl-CoA, which is right here, which is eventually converted into HMG-CoA. The most crucial step is when the enzyme HMG-CoA reductase converts, right here, converts the HMG-CoA into menvalinate. And we call this the rate-limiting step because it effectively controls the speed of cholesterol production. After menvalinate is formed, there are several additional steps leading to the final product, cholesterol. The key point is that if we inhibit HMG-CoA reductase, we significantly reduce the liver's ability to make cholesterol. And this is such a good figure. I'll come back to it. So Lovastatin, this is where Lovastatin comes in. So it's actually a prodrug in a closed ring or lactone form. Once the Lovastatin is absorbed, the body converts it into an active hydroxy acid form. This active form resembles the natural substrate, HMG-CoA, and competes for the active site of HMG-CoA reductase, as you can see right here. So brilliantly, it shows that the statins are competing with this, and that's what stops it. But let's go back on track. So Lovastatin will block the production of menvalinate, and that'll lower the cholesterol synthesis, as we said. Another important effect is that when the liver makes less cholesterol, it responds by increasing LDL receptor numbers on its surface, which helps pull more LDL out of the bloodstream. Altogether, this process, significantly reduces the bad cholesterol levels that we were talking about that can do a lot of damage. So let's go into a couple clinical effects. So clinically, Lovastatin can obviously varies patient by patient, but mainly lower LDL cholesterol, dependent on the dose, dependent on the patient, dependent on their diet as well. And in some patients, it even slightly boosts the HDL levels, the good cholesterol. This decrease in LDL is crucial because it helps reduce plaque buildup in the arteries, lower heart attacks, lower the risk for heart attacks and strokes. And like all other statins, lovastatin is generally well tolerated, but even where I work at, a lot of patients can complain of side effects such as joint pain, muscle pain, that are related to taking statins. But of course, that's not with every single patient. Yeah. Let's see. But yeah. Overall, lovastatin's ability to inhibit HMG-CoA reductase makes it an extremely effective therapy for managing high LDL cholesterol and supporting cardiovascular health. Thank you guys again for taking the time to watch this video, and yeah, I hope I did great. And